We're going to be having a conversation about abuse and review LaPointe Fisher Nursing Home's policy. What is abuse and neglect? A long-term care home is the primary home of its residents and is to be operated so that it is a place where residents may live with dignity and in security, safety, and comfort, and have their physical, psychological, social, spiritual, and cultural needs adequately met. The Point Fisher Nursing Home has a zero tolerance policy for abuse and neglect. The Long-Term Care Homes Act of 2007 defines abuse as in relation to a resident, meaning physical, sexual, emotional, verbal, or financial abuse as defined in the regulations in each case. We will be going through these definitions of abuse in more detail. The Act also defines neglect as failure to provide a resident with the treatment, care, services, or assistance required for health, safety, or well-being, and includes inaction or a pattern of inaction that jeopardizes the health, safety, or well-being of one or more residents. We're going to look at emotional abuse. You can see that there are two definitions on the screen. The first definition is in relation to staff emotionally abusing a resident, and it is defined as any threatening, insulting, intimidating, or humiliating gestures, actions, behaviors, or remarks, including imposed social isolation, shunning, ignoring, lack of acknowledgement, or infantilization that are performed by anyone other than a resident. So an example of a threat is if you don't do this, this means you're stupid. That also can be combined as an insult. Intimidation is something like I'm bigger than you, so I'd be careful if I were you. Humiliation would be look at you, you wet your pants. Imposed social isolation, you're going to stay in your room until you learn to behave. Shunning or ignoring is when a resident calls for help as you're walking towards them and you turn the other way, or as you walk past the resident, you don't acknowledge them. And infantilization is using baby talk towards a resident. The second definition is any threatening or intimidating gestures, actions, or behavior or remarks by a resident that causes alarm or fear to another resident, where the resident performing the gestures, actions, behavior, or remarks understands and appreciates their consequences. So the second definition relates to resident emotional abuse. If you witness an incident of potential emotional abuse, it is important to ensure that the recipient is immediately interviewed for emotional distress. Do they look shocked? Are they expressing fear? Are they upset by the remark? If not, then it would not be considered emotional abuse. Also, the aggressor must have the capacity to know the consequences of their actions. Let's say you have a resident who's hallucinating, and they go up to another resident and say, "You're gonna get it, I know what you did in the war." This causes distress to the recipient, but the resident who is causing the emotional response is not able to comprehend the consequences because they are in an active hallucination. This would not be an instance of emotional abuse. Financial abuse means any misappropriation or misuse of a resident's money or property. This can be resident to resident, staff to resident, or a resident's family member to their loved one. Examples of financial abuse would include taking a resident's bank card to complete their shopping on their behalf without their consent. Or you can overhear a conversation between a family member and a severely cognitively impaired resident, asking them to sign a document that would give them access to their banking information or any of their funds. So for physical abuse, there are 3 different definitions, and we're going to go through each one of them. Physical abuse means the use of physical force by anyone other than a resident that causes physical injury or pain. So this can be staff to resident, this can be family member to resident, this can also be a visitor to the resident. Essentially, this would mean that the aggressor is not a resident of the home and is causing physical injury or pain to another resident. However, there is a clause for this definition. Physical abuse does not include the use of force that is appropriate to the provision of care or assisting a resident with activities of daily living, unless the force that is used is excessive in the circumstances. So let's say there is a resident who has significant responsive behaviors and refuses to go into the tub room. The resident is disheveled, has very greasy hair. We know that the resident requires personal hygiene in order to prevent infection and to also allow for that dignity and respect. If we were to use gentle persuasion approaches on the resident to assist them into the tub room, even though they're being responsive and saying no, this would not be defined as physical abuse. The second definition says administering or withholding a drug for an inappropriate purpose. An example of this would be a resident approaches you asking for their pain medication. The registered staff member has a belief that the resident is drug seeking. Therefore, the registered staff refuses to administer the pain medication. The last definition is the use of physical force by a resident that causes physical injury to another resident. So this is resident to resident abuse. It is important to note that all incidents of physical aggression between residents that result in any physical injury, redness, bruising, cuts, must be reported to the manager on call. If there is an episode of physical aggression between residents, you must document the incident in the aggressor's chart and in the recipient's chart. You would do this through the risk management system. It is important to note that none of the residents' initials should be included in the progress notes. Each resident has a unique identifier number that can be found next to their name in PCC. It would be LF and a 4-digit number code. Those numbers should be used when documenting incidents of physical aggression between residents to ensure confidentiality and protection. If the POA were to request a resident's medical chart, they would have the ability to decipher the initials of the residents involved. If it is the case where a staff member happens to cause physical abuse towards another resident, the staff member's initials should not be named, nor should their full name be put in the progress notes, again, for that protection and confidentiality. Sexual abuse also has many definitions. So sexual abuse means any consensual or non-consensual touching, or behaviors or remarks of a sexual nature or sexual exploitation that is directed towards a resident by a licensee or staff member. The last definition is any non-consensual touching, behavior, or remarks of a sexual nature or sexual exploitation directed towards a resident by a person other than a licensee or staff member. So there are some exclusions for sexual abuse. So touching, behavior, or remarks of a clinical nature that are appropriate to the provision of care or assisting a resident with activities of daily living is not considered sexual abuse. So this would be the administration of suppositories, the administration of intravaginal medications, or providing a resident with pericare. Lastly, When it comes to sexual relationships, if the resident had a sexual relationship outside of the home prior to being admitted with one of the staff members and eventually was admitted to the home and they were to engage in activities, it is not considered a form of sexual abuse. Also, if there was a resident in a long-term care home who had a relationship with someone outside of the home, and then that person happened to get a job within the long-term care home and still have relationships with the resident, it would not be considered a form of sexual abuse. Verbal abuse means any form of verbal communication of a threatening or intimidating nature, or any form of verbal communication of a belittling or degrading nature, which diminishes a resident's sense of well-being, dignity, or self-worth that is made by anyone other than a resident. The same sort of stipulations apply. This would be staff to resident, family member to resident, a visitor towards the resident, anyone who is not a resident of the long-term care home. The second definition would be any form of verbal communication of a threatening or intimidating nature made by a resident that leads another resident to fear his or her safety, where the resident making the communication understands and appreciates its consequences. We can kind of go back to the example of the resident that is hallucinating for this case. The resident who is hallucinating and yelling at a co-resident, saying, "I know what you did in that war," would not have the ability to understand the consequences of communicating to their co-resident in that way. So the staff responsibilities when there is a case of abuse and neglect. They must immediately and directly report any witnessed incident or alleged incident of abuse or neglect. You immediately report it to the appropriate supervisor in the home on duty or on call at the time of the witnessed or alleged incident of abuse or neglect. You want to make sure you maintain confidentiality regarding the report and the names of all those involved in the incident. Like I said earlier in previous slides, you want to use that resident LF identifier number when you're documenting into residence charts, or if it is a staff member, you do not want to reference their name or their initials. You want to take appropriate action in response to any suspected, alleged, or witnessed incident of resident abuse or neglect. Appropriate action would be ensuring that the resident is safe. The staff members are safe. Safety is our #1 concern overall. Staff must investigate immediately all reports of abuse and neglect. All investigation notes must not be included in the resident's medical chart. Ensure you record them on the supervisory occurrence report or within the internal risk management system. Keep in mind that all staff have the right to union representation while investigation is being conducted regarding the incident. The staff must also notify the resident and the resident's substitute decision maker, if any, and any other person requested by the resident of the results of the investigation immediately upon its completion. However, despite the above, if the substitute decision maker is the alleged perpetrator of the abuse, there is no obligation to report to them the results of the investigation. Interventions for resident abuse and neglect. You want to ensure that the resident is not left in the responsibility of the person alleged to have caused the abuse or neglect. Ensure safety and protection of staff and residents involved and all other residents that may be exposed to risk of harm. You want to conduct a head-to-toe physical assessment on the alleged victim, the alleged assailant, and document the findings if physical abuse is alleged. You want to make sure you interview all parties involved, especially the residents, as soon as possible. Document your questions asked and the responses. Keep in mind that the resident's presentation and emotional response to the incident should be assessed. Contact the physician if necessary or other healthcare practitioners for further assessment, treatment, and follow-up based on nursing assessment of injury, pain, or suspected injury such as wounds, fractures, or head injury. You want to document and communicate the status of the resident's health condition, further assessments arranged, and health investigation findings to the manager on call. And if need be, offer information about resources to the residents and their family members, anyone who's involved in the alleged incident, such as social work, counseling, legal advice, pastoral care, the Community Care Access Center, the physician, and the psychiatrist. If you have any further questions about abuse and neglect of residents, please speak with the ADON. Thank you so much.